Hi, I'm Olivia, an intern with Student Action with Farmworkers. This summer I'm working with Piedmont Health Services in the Migrant Health Program, and we're doing outreach with farmworkers in North Carolina. Though we've been doing a lot of outreach into the fields where farmworkers live and work, one experience that's really stuck with me actually happened in the clinic. A few weeks ago, I had an opportunity to accompany a farm worker to a doctor's appointment in our clinic to help her interpret between the doctor and the patient. As I walked over to greet the farm worker and sit with him until we were called back, I was hit with a wave of nervousness because this was my first time to interpret. There were so many words that I didn't know, especially concerning anatomy and medical conditions. I felt unprepared, yet I smiled and greeted the farm worker, and we were called back to see the doctor. I was able to interpret between the medical assistants and the farm worker as they measured his blood pressure, weight, and temperature, and then I started to feel more comfortable. As we waited in the exam room, I made conversation with him to learn about his life, his work, and importantly, the reason for his visit that day. We both relaxed and talked as we waited for the doctor to come in. To my surprise, the doctor came in and greeted us in Spanish. Though she wasn't perfectly fluent, she was proficient enough to communicate with the patient and talk about his concerns. Throughout their conversation, I listened and assisted the doctor whenever she needed more precise language to communicate with the farm worker. I felt very comfortable holding this role. The farm worker also saw a social worker who was perfectly fluent in Spanish, and in this case, I mainly observed. I saw a positive change in the farm worker's mood as he was able to speak with a social worker as he would a friend. The social worker was also able to get the most accurate information from him about his troubles as they were speaking. This experience has shown me the importance of having bilingual health providers and available translation services. If the farm worker didn't have an interpreter available or providers who spoke Spanish fluently, his experience would have been very different. This space of bilingual health care allows for more people to access care and receive better quality of care. As I go into the field of public health, this experience has inspired me to improve my Spanish skills and become a medical interpreter in the future.